Hi YouTubers! I wanted to make this very important video because I think it's imperative that I cover this subject, and I think it's important for the women of the cryptic pregnancy community to completely understand the magnitude of claiming that doctors and technicians are keeping cryptic pregnancy or extended gestational pregnancy a secret. They say that they're keeping it a secret by purposely not finding, purposely ignoring, or purposely overlooking their baby or a baby during an ultrasound or physical. I wanted to also say that just because you are too scared to go to the doctor or too scared to go to a different doctor and continue to search for answers does not mean that a cryptic pregnancy or extended gestational pregnancy exists. And if I'm going to be completely honest, doctors are not my go-to for healthcare. It's nothing personal. It's just, if I'm being honest, doctors are taught to only treat symptoms, and they love to sell legal drugs, and that's not my go-to anymore. So I've completely changed to a more holistic approach. However, with this said, many of these doctors commit their lives, and to this, commit long hours away from their family, friends, and loved ones and community in order to call themselves a prestigious doctor. You know, it takes a lot of time. So doctors have records. They can be reported and sued for many things that I won't get into in this video. Doctors, nurses, aides, specialists, anybody in the medical community, it is all the same. They can all be reported, and you can find case reviews and lawsuits against doctors. Nurses have a registry, and they keep track of their disciplinary actions and suspensions. You can find anything negative against any medical professional you wish, and you can also report any medical professional you wish. And professionals can report professionals. So a doctor can report a nurse, and a nurse can report a doctor. As someone who has witnessed such cases with my own eyes, so I've been to these court cases where, complaints have been filed against nurses, and it is part of your training as a doctor, nurse, any medical professional to protect your license. And in order to protect your license, you have to double check, triple check, quadruple check your work. You have to make sure that you are doing things correctly, especially because you could be sleep deprived, you can be hungry, you can be distracted by, at-home drama. There's always a reason to double check and triple check your work. And in the medical setting, you make sure you watch yourself, and you're always protecting your license, because without it, you cannot work. And then what was the point? Not only do you watch your butt for your own license, but the facility you work for could get sued as well for employing you. So you want to do the right thing. You want to do the right thing for the patient. You want to do the right thing for yourself, and you want to do the right thing for the facility you work for. You also want to make sure that the people around you are doing correctly, and because just by association, you can be drawn into a court case because you didn't say anything. So you can also, like I said, you can also report other professionals for misconduct or certain things. Excuse me. Sorry. So, doctors are not trying to hide a cryptic pregnancy, nor are they creating a conspiracy to keep an extended gestational pregnancy with a slow-growing baby a secret. In my reality, I know a lot of doctors who love to make money, and a 3 to 5 year pregnancy makes way more money than a 9 to 10 month pregnancy. Just the amount of ultrasounds the doctor would want to order to monitor such a miracle would be crazy. So, like I was saying, doctors are not evil people. And the few that are easily avoided. Most doctors I have met and know are always trying to help and help others heal themselves. It is important to understand the immense implications the cryptic pregnancy community is implying against the medical community. The amount of people it would take to set up a plan like this in motion, and the amount of brainwashing it would take for people to deny a baby and then deny a mother prenatal care is outrageous. Even if a doctor is a little more stern, or they're a little bit more old-fashioned, there is always somebody in that hospital, in that office, who is willing to help you, and that is their job, to help you. So be realistic. Most people who go into the medical field do want to help and do want to help you heal yourself. I love a good conspiracy theory, but this is up there with the best. Cryptic pregnancy myth, that doctors will deny the baby because ultimately doctors deny an extended gestational pregnancy. That is not true. I have heard in the cryptic pregnancy community that it is because doctors can't control it, or because doctors won't like that they don't have a due date, or because doctors don't like that it is unpredictable with the baby size, labor, delivery, and or finding baby. If an extended gestational pregnancy does exist, then it would have to have existed in the last 500 years or so. Meaning, medicine men and midwives would have known and written about it for years. But you find nothing. No reminiscence. You can find residue for almost anything in history that has been changed or modified, but you can find nothing on an extended gestational pregnancy lasting past the rare 12 months. So now my question is this: do these cryptically pregnant women think that this condition has evolved in the last 100 years or so? And if so, that means their genes would have mutated, and that can be tested. So to conclude, most healthcare professionals are there because they want to help you. If you were to ask them directly for help, they would make it happen because that is their job. There is no conspiracy to keep an extended gestational pregnancy a secret in the medical community. And in reality, the amount of doctors and scientists that would be interested in studying such a miracle would be immense. The woman would get the best care in the world if they really were pregnant for an extended time, as far as 3 to 5 years. So please, if you think your doctor has treated you unfairly or poorly, ask a nurse to be present as a witness. And if he brushes you off again, report him. Get a new doctor and continue searching for answers. Every doctor is different, and most are there to help you and help you heal. I hope this video helps somebody. If you have any questions, please leave them in the comments. Don't forget to like. If you want to see videos in the future, don't forget to subscribe. Thank you guys for watching. Bye.